Bismillahirrahmanirrahim. Hello, dear students. I hope you will be fine and have a good time. Our lesson is about the respiratory physiology. In this session, we should be uh, discussing about the uh, pulmonary ventilation. Uh, we have a um, 5 chapter about the respiratory physiology, chapters 38, chapter 39, and chapter 40, chapter 41, and chapter 42. And you can use the original book about the uh, respiration physiology in your reference. And the reference is about the guide on physiology, and you should be read carefully and read about the chapter 38, 39, and 40, 41, and 42. In this session, we focus on about the chapter 38. In this, for the introduction, you should know the lung function is very different, and for example, lungs are a site for gas exchange with the external environment. This is uh, the the main function of the lung, the main lung function. Another function, for example, is a regulated acid balance, and lungs have a defense mechanism, and lungs are a blood reservoir and serve a biosynthetic function. In the chapter 38, the we discussing about the pulmonary ventilation. For this definition is moving air into and out of the lungs. This means ventilation. The main function of respiration are to provide oxygen to the tissue and remove carbon dioxide. The four major components of the respiration are the pulmonary ventilation, which means the airflow and outflow of the air between the atmosphere and the lung alveoli. 2 is a diffusion of oxygen and the carbon dioxide between the alveoli and the blood. 3 is the transport of the oxygen and carbon dioxide in the blood and the blood body fluids and from the body's tissue cells. And the 4 is regulation of the ventilation, and other facets are respiration. This chapter is discussion of the pulmonary ventilation, and the subsequent 5 chapters cover other respiratory function plus the physiology of special respiratory abnormalities. You should know the respiration divided two kind of the respiration we have. One is the intracellular and or internal and or cellular respiration, and the other is external respiration. Okay, you can see in this figure in the exchange exchange of one atmosphere to lungs means one ventilation. Exchange 2 is lungs to the blood, transport of the gases in the blood, another steps, and the final steps is the exchange 3 is the between the blood to the cells. Okay, after that this kind of the oxygen is used and produce CO2 carbon dioxide in the cells, and after they produce ATP, and the CO2 is transported from the systemic circulation and comes back to the pulmonary circulation and transport to the alveoli of the lungs, and they are removed from the alveoli through the airways to the atmosphere. Okay, oxygen entered from atmosphere to the body, and CO2 exit from the alveoli to atmosphere is opposite sides. And the respiration is the exchange of gas between the body and the environment. The external respiration means the exchange of the gases between the pulmonary blood and the external environment, which involves not only diffusion across the lung capillaries and pulmonary gas exchange, but also the back movement of gases in and out of the lungs. This means pulmonary ventilation. Okay. Another kind of the respiration internal, the exchange of the gases between the tissue cells and the systemic capillaries, and diffusion of the gases between the interstitial fluid and the cytoplasm. The function anatomy of the respiration system, for briefly, this system starts from the nose of the mouth, and after that the pharynx, after that the larynx, after that trachea, and the bronchi and smaller bronchi, and terminal bronchioles, and respiratory bronchioles. After that we have alveolar ducts, and after that alveolar sacs, and the end of this system located the alveoli. Okay, this shows the functional anatomy of the respiration system for very brief. And pulmonary ventilation mechanism, what is the contraction of the diaphragm, is very important. This mechanism for the respiration divided to two process. One process is the inspiration, another is expiration, opposite side of the air movement. And this mechanism, we have a contraction of the chest elevating muscle, and for increase in the anterior posterior mostly, and the transverse dimension of the thorax. And this mechanism, we have a contraction of the diaphragm, but this causes the increase in the vertical dimension of the thorax and pulling off the lungs outward and downward, and this causes the expansion of the lungs, and this causes decrease in the intrapulmonary pressure, establishment of the pressure gradient from the atmosphere to alveoli. Okay, and this causes the start of the inspiration. After the inspiration start and finish, in the start of the inspiration, intrapulmonary pressure becomes equal to atmosphere in the end of the inspiration. Okay, and for the another process is the expiration. Expiration is opposite with inspiration. In this mechanism, started with relaxation of the respiratory muscle. This causes decrease in the size of the thorax, compression of the lung under the steps, and decrease in the size of the lungs, and increase in the intrapulmonary pressure. Establishment the pressure gradient from the alveoli to atmosphere, and this started expiration. Intrapulmonary pressure becomes equal to atmosphere pressure, end of the expiration. Okay, and this mechanism shows the mechanism of expiration. You can see in this figure contraction and expansion of the thoracic cage during the expiration and inspiration, demonstrating the diaphragm contraction, function of the intercostal muscle, and elevation and depression of the rib cage, IP anteroposterior, shows anterior posterior. You can see in the inspiration the rib cage elevated and the diaphragmatic contraction, and this you can in this here increased vertical diameter in this here, and after that increased anterior posterior diameter in this section, okay? And after that, in this process, plus diaphragm, external intercostal contraction as well is very important. And we have two intercostal muscle. One is external intercostal muscle contraction is involved in the inspiration, but internal intercostal in this situation is the relax. Okay. After that, you can see for the expiration, this is opposite with this side, with this figure. This figure shows the inspiration. This shows the expiration. Okay. The lung can be expanded and contracted in two ways, by downward and upward movement of the diaphragm to lengthen or shorten the chest cavity, and by elevation and depression of the rib to increase and decrease the anterior posterior diameter of the chest cavity. A figure shows these two methods. Okay, you should be know and studying more in the book as well. Therefore, for this we should be know a muscle that cause lung expansion and contraction. For example, one most important muscle is diaphragm. Diaphragm is the main muscle of the inspiration. You should be remind, okay? Is dummy shaped during the inspiration. Contraction of the diaphragm pulls the lower surface of the lungs on downward. Another muscle is external intercostals. This muscle contraction of the internal intercostal muscle makes chest volume larger. Another muscle, sternocleidomastoid, which lie high upward on the sternum. Another muscle, anterior serrati, which high many of the ribs. And other muscle is escalene, which lift the first two ribs or high the first two ribs. For this second method for expanding the lungs is the raises the rib cage. Raising the rib cage expands the lungs because in the natural resting position the rib slant downward, as shown on the left side of the figure of the task, allowing the sternum to fall backward toward the vertebral columns. When the rib cage is elevated, however, the rib projects almost directly forward